What I coach my clinicians that I consult with to follow is what I call, climbing the hierarchy of the inattentive syndrome, or in other words, what other causes might we have to rule out before we can say at the top, yes, we have left ADHD as a core suspect. Well, at the bottom level is substance use or other substances that could impair attention. By far, the most common one that is often underappreciated in this context is cannabis. I'll highlight the most common and, again, sometimes under-recognized medical condition causing an ADHD-like syndrome is sleep apnea. Sleep apnea is strongly associated with impaired performance, especially as tasks get more complicated. And then the last one to highlight is mental health, or what I would just say psychiatric causes. And again, there are numerous, but I would highlight anxiety as probably being the most common. Anxiety is a condition of inattention. We know from research that we don't focus well if we're having high intensity of anxiety. And that includes people with not just state anxiety, I'm anxious now, but people with what we call trait anxiety, people who are more naturally anxious chronically. They can struggle to direct focus in the way that they need to, and it can create an ADHD-like syndrome.
Welcome to Hyperfocus and High Performance with Christine Howe, where we explore how you can work with your brain, build your dreams, and live on purpose with more clarity, creativity, and presence. We are talking with Joe Andrews, a psychiatrist whose work sits right in the middle of one of the most important conversations happening in mental health today: accurate diagnosis. Because for so many people, especially high-achieving, creative, overwhelmed adults, the question is not always simple. Is it ADHD? Is it anxiety? Is it trauma? Is it autism? Is it bipolar disorder? Is it nervous system dysregulation? Is it relational trauma? Is it more than one thing? And what happens when one professional says one thing, another professional says something else, and you're left holding the confusion? In this conversation, I want to go beneath the surface of all of these. Not just what are the symptoms, but what are we actually looking at? What gets missed? What gets mislabeled? And what is the danger of not knowing what's actually going on? As a licensed professional counselor turned coach, I care deeply about this because a diagnosis is not just a label. It shapes the way you understand what you are dealing with and even how you understand yourself. It shapes the kind of help that you then seek. And then it shapes the story you tell yourself about why some of these things in your life have felt so hard, why you've been able to achieve success in some areas and not in others, and what the future could actually bring for you. And when you are brilliant, capable, and still struggling, you deserve more than a quick label. You deserve clarity. So today we are going to talk about ADHD, dual diagnosis, trauma, autism, bipolar disorder, gut health, medication, self-diagnosis, and what it looks like to pursue answers with wisdom, curiosity, and care. Joe, I am so excited that you're here today for this conversation. I think it is such an important conversation today in the land of Instagram diagnoses of ourselves. What a privilege to be able to talk with a real psychiatrist and someone who's going to help us differentiate. Is this ADHD? Is this something else? Is this several things? And all the implications in between. I've read that up to 80% of people with ADHD have something else going on too in the mental health diagnoses. And so I think this is such an important conversation because it's not always just, do I have ADHD? But because it rarely travels alone, over half the time it's not traveling alone. We need some wisdom in differentiating what's happening. So thank you so much for being here today.
It's my pleasure. Thanks, Christine. Really appreciate it.
Absolutely. So I really want to move beyond simplified conversations about I'm distracted and, life is hard and overwhelming to some very specific understanding for my ADHD high achievers and creative leaders, people trying to really piece together. I see this place I think I'm capable of getting to, but I'm performing down here, or my relationships are falling apart. I can't figure it out. Or just this feeling of dis-ease in my soul. Like it can manifest in a lot of different ways. But as I work with high performers trying to figure this out, ADHD seems to be everywhere right now. And people are talking about it online, on Instagram, TikTok, podcasts, parenting groups, and in therapy. But it seems like the more we talk about it, the more we think we understand, but we don't really understand. And then knowing that it doesn't always travel alone, it just can get really confusing. So what do you think makes getting an ADHD diagnosis more complex than a simple checklist of symptoms?
Yeah, great question. I think it's one thing to see the description, the criteria, something that can be simplified into one page, right? Like a DSM criteria or ICD criteria. And we can look at these symptoms and we can see ourselves in them. And we say, yeah, I have that, or I have that. The thing is that that could be true of a lot of different diagnoses. I've noticed that if we pull up various different anxiety syndromes, personality conditions, and we look at the criteria, it's not hard to see ourselves in some of these struggles that are described and defined in things like diagnostic manuals. And so that begs the question, how confidently can I know that this is in fact what I have, right? I identify with these descriptions, and yet how confident can I be that this in fact explains at a core level what I'm struggling with? And the fact is that it's really hard. It's really hard. And to know at a deep and core level what we're struggling with in diagnostic terminology is challenging, because none of us are really naturally going to be bringing diagnostic experience with us to our own life and our own situation. We might know ourselves really well, but that's one person, right? Whereas a clinician, an expert, has seen dozens, hundreds, even thousands of cases where they have an opportunity to see case after case and get that deeper understanding of what's going on. And so I think it's wonderful that there's so much interest in mental health, in ADHD, in my practice and in many practices that I consult with. We're seeing this same report over and over again. Clinicians telling me every day we're getting requests for ADHD evaluations and suspicion of diagnoses. And on the clinician side, sometimes it can be a bit overwhelming, just the outpour of interest and response to this. We need to, of course, manage this on the provider side too. And really what it comes down to is getting a proper diagnosis, having a thorough evaluation from an expert. One of the comparisons I was once told came from Dr. Paul McHugh. He was a former chairman at Johns Hopkins Psychiatry, and he's published many books and very well-known figure. And he used to equate the DSM, or diagnostics manual, to more like a birding manual, where you can go out into the woods and you can bring your birding manual and you can say, okay, that's a finch, or I know that that's a crow, or whatever you might find, because you can see, okay, it looks like this, it's got wings like that, the color pattern, the beak, right? And so we can say, yeah, that's what that is. But there's a big difference between a birder and an ornithologist, who is an expert at understanding the bird and their behavior, their mating patterns, their physiology. I try to be as the expert. I try to be the ornithologist, where, yeah, many folks might be able to look and say, this looks like that, but can I come in and say, yes, but it also could be something else? And so we need to look at all the possibilities.
That's awesome. What are some of the things that you see getting confused when people are walking in and they're like, I think I have ADHD? Is there a pattern that you've noticed? What are you seeing when people come in? Is it usually ADHD? Are they right? Is their intuition correct? Or are they usually kind of partially right? I'd love to introduce you to something I created specifically for brains like yours. Think Time Membership is a guided neuroplanning membership designed to help you align with your design, work with your brain, and build your dreams with more clarity, confidence, creativity, and presence. Instead of forcing yourself into systems that don't fit you, you'll learn how to plan in the native, creative language of your brain using my neuroplanning framework. Love your design, then dream, decide, do, review. Inside the membership, you'll join a community of growth-oriented leaders for weekly, monthly, quarterly, and annual guided planning experiences, so you'll never have to figure it out all alone. Your membership also includes access to the Think Time Neuroplanner, a whole brain visual planning system designed to help you harness the strengths of your mind instead of constantly fighting against it. And when you join, you'll receive access to the neuroplanning course and tutorials, planning tools and templates, live group coaching, monthly Q&A, and a live onboarding session so you can begin to use the system right away. If you're ready to increase your opportunity to experience more clarity, calm, confidence, creativity, meaningful productivity, and presence while getting more of the right things done in less time with peace, not pressure, visit think-time.com/podcast. I'd love to help you build a life that works with your brain, aligns with your design, and reflects what matters most.
Yeah, great question. Mixed is really the answer there. Sometimes spot on. Yeah, people accurately recognize that's what's going on, and then
Okay.
sometimes we dig deeper and we say, maybe there could be a better explanation here. Maybe we're missing something. ADHD, especially in an adult, is actually a very difficult and complicated diagnosis. I spend every day helping other clinicians with navigating these processes. ADHD is a condition involving the presence of what I call the inattentive syndrome, which is a collection of different symptoms and how they impact our ability to initiate, sustain, and complete things. It also is the presence of the inattentive syndrome in a neurodevelopmental trajectory, meaning it's been present from childhood. It persists throughout life. It is also one that has to cause a significant amount of dysfunction to reach clinical significance. And then lastly, it can't be better explained by something else. Well, that's a mouthful, right? That's a lot to explain, right? And to understand and to deeply really wrap our head around, right? Inattentive syndrome and a neurodevelopmental trajectory causing significant dysfunction and not better explained by something else. Hard to say in one breath, frankly. And so that's the challenge we have diagnostically, right? And again, it's only more complicated in an adult because we have more timeline to work with. We have more variables. We have more other potential confounders to deal with. But there are three things that I would focus on for the purposes of what else could it be. And what I coach my clinicians that I consult with to follow is what I call, climbing the hierarchy of the inattentive syndrome, or in other words, what other causes might we have to rule out before we can say at the top, yes, we have left ADHD as a core suspect. Well, at the bottom level is substance use or other substances that could impair attention. By far, the most common one that is often underappreciated in this context is cannabis. There's a massive amount of research to show how regular cannabis use, especially adolescent onset cannabis use, impairs attention, and it persists even beyond the acute effects. There's research to show that chronic users, even when not actively under the influence, will show the definitive differences in neurocognitive performance. And so that's a big one.
The reaction, that's huge, especially right now with the legalization of cannabis. Like that is, so when they're not using, I mean, it makes sense, right? The brain's damaged and it impacts the attention. It actually still damages the brain, even if it's legal. Like that's so important for people to know right now. And so you're seeing that increasingly then, I bet, with the legalization of cannabis.
Very, very common, right? Originally legalized as a medical designation and more recently being designated as recreational. But nonetheless, yeah, we've seen a wave of legalization. We know that it leads to increased use. In fact, there was a recent study to show in California that adolescents were significantly more likely to use cannabis after the legalization of cannabis in that state. And it goes up to about 10%. I mean, 10% of adolescents in California had reported using cannabis. That's a significant number. And we have research to show that unfortunately, adolescent use is associated with failure to ever fully develop the brain into what it could have become. And there's detailed studies and prospective studies to show this.
That's tragic. That is absolutely tragic because it is still developing till 25, right? The brain's architecture, formation of those fundamental networks that are communicating with each other are being inhibited by the use of cannabis in the teen years. That breaks my heart. And so that's what you're seeing as a teacher of clinicians. You are the one who helps the clinicians to distinguish what's real, what's not. Okay, that's awesome. So that's number one. You've got number two and number three.
So climbing that hierarchy, what else might we need to assess for? What else might explain inattentiveness? The next is medical causes. There are numerous medical conditions that will impact our neurocognitive performance, including attention. I'll highlight the most common and again, sometimes under-recognized medical condition causing an ADHD-like syndrome is sleep apnea. Sleep apnea is strongly associated with impaired performance, especially as tasks get more complicated. Our ability to tolerate those with an undernourished or under-recovered or replenished brain is going to be more and more challenging. And so sleep apnea, it will have symptoms of fatigue, sleep craving, poor focus, little mental energy or endurance or tolerance for difficult tasks. And we often don't know we struggle with it, right? We don't notice ourselves not breathing while we're sleeping because we're sleeping. When we sleep, our brain paralyzes most of our muscles. It relaxes. But unfortunately, part of that is the muscles in the throat that normally keep our airway open. So those start to collapse. Airway becomes more turbulent. We get snoring. We can get complete apnea or stoppage of breathing at night where oxygen levels drop significantly while we're sleeping. And basically our brain just doesn't get replenished at night. We're sleeping, we think we're sleeping, and we are, but we're just not getting effective sleep. And so that's a very, very common cause of an ADHD-like syndrome. I've had more cases than I can even count at this point where I've had someone appropriately evaluated and treated for sleep apnea, and their symptoms of inattention, among others, improve significantly. I've seen people who reduce or come off of their stimulant medication after their sleep apnea is treated because they just don't tolerate it anymore. They don't find that it's needed. So that's a big one on the medical side. But again, there's many others that affect the brain, of course, that will impact attention. And then the last one to highlight is mental health, or what I would just say psychiatric causes. And again, there are numerous, but I would highlight anxiety as probably being the most common. Anxiety is a condition of inattention. We know from research that we don't focus well if we're having high intensity of anxiety. And that includes people with not just state anxiety, I'm anxious now, but people with what we call trait anxiety, people who are more naturally anxious chronically. They can struggle to direct focus in the way that they need to, and it can create an ADHD-like syndrome. And so, but also, as you pointed out too, there's a lot of co-occurring conditions. Anxiety and ADHD do highly co-occur. So it's not necessarily one or the other, but it's just to say that it can sometimes better explain what is going on before we jump to ADHD. And that's relevant because many treatments for ADHD can worsen anxiety. So we want to be very careful about that, right? Or if we're missing sleep apnea, nothing we are going to do is going to ultimately help. I've seen people on large doses of stimulants who still struggle to stay focused and energized during the day, and then we get it treated and they don't need it as much. So it's not necessarily one or the other. It can be both, but we want to make sure we're not missing something really important.
So if I am on an ADHD medication and it's not working, something I might want to consider is, do I have sleep apnea?
Yeah. Do I have sleep apnea? Do I have is it some other diagnosis? Does something else explain what's going on? Now, there are folks who have ADHD but still don't respond well to medication. That absolutely can happen. But I would definitely be concerned that we might be missing something if we're not getting a response.
What about, I've heard like vitamin D, for instance, can impact depression. And I know depression and anxiety can kind of co-interact. And what about something like vitamin D? Would that impact?
Yeah, absolutely. I would put that in the category of medical causes of an inattentive syndrome. That one's more likely to cause a fatigue, a lack of energy, which can include mental energy. But again, that flows to our performance, our ability to execute on things. Interestingly, there was just a study that came out that showed low vitamin D levels in middle age are associated with subsequent development of dementia. And so we know there's a vitamin D cognition relationship there that we need to be aware of. We don't need to have high doses of vitamin D. You know, we need to be in the normal ranges. We don't need to go too overboard with that. But yeah, we want to make sure our vitamin D is in a healthy range, and that can be easily checked on a blood test.
So is that going to be D3?
Well, there's different ways to measure vitamin D. 25-hydroxy vitamin D is the most common way to just measure it in the bloodstream. But any over-the-counter vitamin D, as long as it's from a good source, reliable source, will be sufficient. There are some cases of severe depletion, and sometimes people will need infusions of vitamin D, an actual intravenous infusion to get their levels up. So there are cases where oral replenishment isn't enough, and that takes more planning. But for many other folks who are on the border, a supplement should be sufficient. I'm just going to throw out a couple other ones just out of curiosity. What about iron? What about vitamin B? Does magnesium have a role? Can you touch on those? Yeah, absolutely. Again, these are very much others that I would put into rule outs within the medical potential causes of inattention. The B vitamins are widely implicated and understood to be part of our energy systems, which of course relate to our cognitive energy as well. And so checking various vitamins, B1, thiamine, B12 are important ones to check. Iron, of course, we need for our blood cells, right? We need to have healthy red blood cells to carry oxygen to our brains, right? And so people with anemia are going to have more of a sluggish experience. And so again, could be easily checked on a blood test to evaluate. Magnesium, I'd have to look more into that in terms of implications with cognition and something similar. We don't routinely check magnesium levels unless there's a specific medical condition that could be implicated. But we know that magnesium can also be associated with better sleep at night, which can help with, of course, our cognition. So, there's some good evidence about the effectiveness and safety of various magnesium supplements.
Okay, that's interesting. Okay, I want to run back to, you said that vitamin D deficiency in midlife can implicate the onset of Alzheimer's later in life. And I've heard that there's this massive vitamin D deficiency across America and the world. I mean, we're always inside. We're not outside.
Definitely something we should be aware of and paying attention to. Again, something that, speak for myself. I make sure that in my annual check with my primary doctor, we're looking at my vitamin D levels and making sure that they're in the right place. So yeah, we don't want to miss that, but it's easily checked on a routine health screening.
Wow, that seems like a super simple preventative step anyone can take, is
Absolutely.
to make sure your vitamin D, because everyone's worried about Alzheimer's. Everyone's concerned about their brain just going offline, and that's so simple. So thank you for sharing that. So, okay, I'm going to go back just for a second. How did you get into this? How did you become Dr. Joe Andrews, the person who helps clinicians to differentiate between all these diagnoses? Like, how did you get to be this niche in this area?
Well, I saw there was a strong need. I saw there was a strong need among my other colleagues, and I saw the opportunity to make a real difference. And so it is truly a calling for me. I graduated residency from Johns Hopkins, which was a wonderful place to train. But unfortunately, the culture there around ADHD was that it probably is not a real thing in adults, and we don't need to worry too much about it. Just make sure that we diagnose, anxiety or depression. And impressionable me said, "Oh, okay, I guess that's the case." I can go into why I think that culture existed, and a lot of that has to do with the fact that it's heavily influenced by inpatient work, hospitalized patients. And so I think that kind of gives the wrong impression and doesn't give a full experience on the outpatient side. Well, I went into outpatient or private practice medicine where I would see cases of ADHD would present to me very commonly. It was something that I recognized is very much something that we need to treat and can make a massive difference in a person's life. I also had the good fortune of working with Dr. David Goodman. David Goodman's a adult ADHD expert, and I was fortunate to train with him for a significant period in residency, and we continued to talk and collaborate, and he's really great. So he was one of my strong positive influences early on about recognizing ADHD, and I really kind of took my journey from there and helped just deepen my own experience and knowledge and expertise and depth with ADHD. And then what I noticed was that other clinicians felt like I did, which was that their training program didn't really prepare them adequately to assess and diagnose confidently an ADHD presentation. So for people who are child psychiatrists, for people who are psychologists who are trained in various types of assessment, they come out of training feeling very comfortable with it. But that leaves other adult psychiatrists, nurse practitioners, physician assistants, licensed social workers, clinical counselors, various other professions who also are tasked with seeing, treating, or diagnosing ADHD who feel underprepared. And so I saw this as a goal and a mission for me to say, I can go in there and make a difference. So in the last several years, I've had the good fortune of working with a number of other colleagues, mostly nurse practitioners, physician assistants, and I do a lot of consultative work. We also call it collaborating. So that's become just a real passion project, labor of love for me, and it's so much of what I do now, and it's only growing in such a positive way. And meanwhile, I'm also building out a course on how to evaluate for ADHD presentations specifically targeted at these professionals who, like myself, I think feel a bit underprepared. So my mission is to help others like myself become more confident in the process here.
That's incredible. I'm so glad that you stepped into, number one, your calling, and you did it by seeing the need, and you're sensitive enough to notice that this matters. And then you looked, what are the skills I can build to create this impact in the world? And then you did it and you built it. So I love that. And nobody told you had to do that. That was all internal and picking up from the world around you what was needed and where you could fit in.
Yeah, the world told me I need to do it because the world needs it.
Yeah, and you responded and took action. I love that. That's incredible. Thank you for the labor of love that it took to fill in that gap. I appreciate that.
Absolutely.
I'm speaking for all of us in this community here. Just thank you. I can't wait to take this course. So get it to the world. I want to take this. Okay, so I'm sure it's going to come at just the right time. And I want to be more excellent in it because I just have sort of thrown up my hands in some aspects where I'm like, I know I don't know enough to be able to discern like you do. I'm not a psychiatrist. I'm just at the counselor level. But there's a piece where as a coach, I have a membership for people with ADHD traits. And I'm like, hey, let's work with your traits. We strengthen the brain and the networks, and use different networks to drive motivation. But in general, I have just come down to speaking in what I call packaging things in nutshells and speaking in broad strokes. And so that way, but what I love about this conversation is that you are the person that I can refer people to say, if you want the details, go there and get the training. And a lot of people in my community are therapists, are helping professionals, are leaders with ADHD who help others with ADHD. And so I think that this is a really important conversation that we're having right now. And so you right now with the Collaborating Psychiatrist, you're actually coaching professionals so that they can be excellent in their discernment between. Is that correct?
That's right.
Okay.
Yep. I help other mental health professionals develop greater confidence with their clinical decision making, and I do that through ongoing consultation with them and education.
And I think that's so good. And I think for all of us, speaking for the professional piece of this side, like when we can recognize I'm not as good in that area, I need to develop more skills so I can be more excellent. It's good to know who to turn to in this area. So I'm really grateful that you are here. The one thing I think that we left as an open loop that I want to make sure we talk about a little bit before closing this conversation is that third piece of the psychiatric differentials. So some things I see getting confused with ADHD are autism, bipolar, borderline personality, trauma, complex trauma, not to load it all too much, but we can even talk just generally speaking. And then you talked about anxiety and nervous system dysregulation, which I would package as, a stressed brain is not your best brain. It's like you cannot function. Your executive function can't function if your fight, flight, or freeze is offline. Like you just can't do both at the same time. So if you're, again, anxiety, I can see how that can be a huge break for that executive functioning. Can you just say something to these differential diagnoses? How do you help people piece through in some clear ways? I know you've got clear systems for this.
Yeah, absolutely. Well, again, it takes a thorough diagnostic process where we're diving into various conditions that might exist. Do we have the presence of an anxiety syndrome? Do we have a history of depressive or manic episodes? Do we see a history of trauma that could be implicated in the nervous system dysregulation? Are there different personality factors that exist that could also be implicated in cognitive dysregulation? The challenge is that difficulty concentrating is a final common pathway for many of these different diagnoses that you mentioned, right? There are different causes. They start in different parts of the brain or in different parts of our life, but the brain only has so many ways that it can have a manifestation of a symptom. Right? There are certain things that output that we feel or that we observe in the world, and trouble focusing is the result of many of these different conditions causing stress, as you said, causing dysfunction. where we don't have the full attentiveness that we need to. Now, there can be some fine tuning in terms of what type of concentration or attention is affected in different kinds of psychiatric diagnoses or disorders, but nonetheless, it's going to manifest in these kinds of symptoms that we feel and observe. So that is the challenge, is that so many things flow into attention.
Man, that's so good. And I think probably people just assume, oh, I have ADHD, and it may be something different. So let's say it's bipolar. I feel like bipolar is the one I want to lean into. What would be the danger if somebody has bipolar and they think they have ADHD? What could that mean for their life? What are the risks of not getting the accurate diagnosis with bipolar?
Well, it's a fantastic question. And again, it's a place where we see a lot of overlap, especially with bipolar. The challenge is that it's, yes, the inattentive side of ADHD can be present, but so can the hyperactive side, right? I focus a lot on the inattentive symptoms because that's just much more commonly experienced in adults. But we also have the hyperactive syndrome as well, which has its own set of manifestations. Well, mania can mimic a hyperactive syndrome, right? They can look very similar, especially when mania is at a lower level or maybe at sort of a prodromal level before it reaches a more severe one. And some folks never reach a very severe level of mania. They stay in more what we might call a hypomanic state. But nonetheless, the manifestation of a hyperactive syndrome and a bipolar syndrome can look very similar. But what is the danger? Great question. One of the biggest ones is that ADHD treatments often destabilize bipolar disorder. They can make things worse, right? And so that's my concern, is that when we miss the diagnosis, we set up a treatment path that takes us in the wrong direction and actually makes a person worse, not better. So that is very much something I fear, and why I take this so seriously, to make sure that we're having the right guiding principle, which is the diagnosis, that leads us in the right direction, right? How do we keep the ship going in the right place? And that starts with knowing what this is, to make sure we don't inadvertently make things worse or just go off in the wrong direction.
That's awesome. Well, thank you so much for adding some clarity. And I feel like you covered the three things that you're looking for primarily when someone comes in and says, hey, I'm having a hard time focusing. And there are these three ways that you think about it. And the first, would you go through the three, just broad stroke one more time?
Yeah, absolutely. That hierarchy of inattentive syndrome, what do we need to pass through and make sure we don't see, so that we can conclude that there are not other better explanations? The first is substances. Again, cannabis being a big one that's commonly implicated and under-recognized, but various other substances and medications can contribute. The next one is medical. Various medical conditions that impact our focus, attention, or energy regulation. Again, I highlighted sleep apnea as a very common one that mimics ADHD, that is under-recognized. And then lastly, mental health or psychiatric causes, anxiety, depression, among others that we discuss here too, that those also have inattention or trouble concentrating as a core symptom, and yet it is not best explained by ADHD. It's rather best explained and therefore treated by, or as I should say, one of these diagnoses. So again, it's substances, medical, psychiatric.
Wow, you just made that feel so attainable and achievable to even think through. And obviously, a person would need to go through the entire battery of the deep, deep, deep dive that you would do with them. But I love having the broad strokes and packaging it in nutshells. So thank you so much for coming and giving us your expertise. If there are some people in the audience who are, I guess I want to talk to two. One is going to be a patient, and the second would be a clinician wanting to further their expertise. Could you talk to those two groups of people and let them know how can they interact with you in the future?
Yeah, absolutely. Absolutely. Well, on the patient side, so much is determined by state laws and where you live. And, we are not able to be licensed everywhere. And so not everyone is going to be accessible on the patient side. But I have a practice that has offices in Maryland and Pennsylvania, specifically in Baltimore and Camp Hill, which is just outside of Harrisburg. And so we do have in-person and virtual availability. Especially if you're close by, we'd love to have you in person. But even if you're not, you're in those states, we can certainly see you. And that practice is called Via Clinic, and their website is viaclinic.us. And then on the clinician side, I do a lot of collaborating and consulting. I'm licensed in various different states, and I'm available to help. And the website there is collaboratingpsychiatrist.com. And there's a contact form at the bottom of the page.
That's great. Well, we will have those links in the show notes. And so if you are wanting to work with Dr. Joe Andrews in the future, he is here to serve and help and is on a mission with a calling to help you get the clear diagnosis that you seek so you can have your best results, so you can reach your personal peak performance. So, Joe, thank you so much for this conversation. I think that what I am taking away is that an accurate diagnosis is not about putting people in a box. It's about helping people finally understand what they've been dealing with their entire lives, what they've been carrying, what they've been compensating for, and what kind of support may actually help them, uniquely them. And for everyone listening, I hope that this conversation has given you permission to be curious about your own story, not ashamed, not rushed to find answers, and definitely not reduced to a label. Curious and connected to who you really are is what I hope for you. Because whether you have ADHD, trauma, anxiety, autism, bipolar disorder, nervous system dysregulation, relational trauma, or some complex combination of multiple of these things, you are not a problem to be solved. You are a whole person to be understood and, frankly, loved. And when you understand your brain, your body, your story, and your support needs more clearly, you can begin to build a life that actually works with you instead of against you. At Think Time, this is a huge part of what we care about. We are not just trying to help you get more done. We are helping you build self-awareness, clarity, and personalized systems that honor how you are designed. So take your next step with care and clarity. This podcast is for educational and entertainment purposes only and isn't a substitute for individualized medical, mental health, or professional care. Every brain is different. Results will vary. Thank you for listening to Hyperfocus and High Performance. If today's conversation helped you think differently about how your mind works, I invite you to take the next step. Visit think-time.com/podcast and grab my free training. Why can't I find a planner that works for me? If you've ever felt frustrated, judged, even by yourself, overwhelmed, or simply wondered why everyone seems to be able to follow a system that simply doesn't work for you, you're not alone. In this free training, you'll discover how your brain naturally approaches focus, planning, and productivity, and why many traditional systems were never designed for minds like yours, and whether neuroplanning could help you increase your opportunity to experience more clarity, calm, confidence, creativity, and meaningful progress with peace, not pressure. And if this episode encouraged you, please subscribe, share it with a friend, and leave a review so more brilliant, creative ADHD visionaries can discover what's possible. Remember, you don't have to become someone else to do what only you can do, because only you can be who only you can be, and otherwise there will be a hole in history. The path forward is clear. Love your design, then dream, decide, do, review. I'll see you next time.